Welcome to the next round of our Webinar Wednesday series. So today we are looking at interprofessional education, and with me I have Vivian Yu, President of the IPE Society and RGU, and Martha, who is the President of the IHI Society at RGU as well, with the Treasurer Fraser Menzies. So they're both going to give wee presentations, and if you want to submit any questions, just use the question and answer box and we will come to them after the presentation. Perfect. If Vivian, are you able to start? Cool.
Hi everyone, hopefully this works because it's on a PDF form. Thank you Joanna and BPSA for inviting me along. I am Vivian, I am the President of the Aberdeen Interprofessional Education Society. So who are we? We are the first IP society in the UK and we were founded in 2012. We are an inter-university society across Aberdeen, so we involve all students from Aberdeen University and Robert Gordon University. We are also the largest academic society at RGU for the past few years. So what do we actually do? So in the slides, I think you can see on the left-hand side, the picture is like of a biomedical station, and we have cannulation in the top right corner, and we have like an OT dexterity kind of test for occupational therapy in the bottom right-hand corner. So we typically organise around 4 academic events and 2 charity events each year, and each event kind of promotes interprofessional learning for healthcare, social work and science students, and they all come together in kind of a team-based and practical setting. So all of our events are student-led, from like creating the certificates to kind of getting people to sign up and advertising and actually teaching. So they're all student-led and they're structured to address like a specific topic each time. And each profession kind of like takes lead and like leads in a workshop station, and they kind of explore their profession within like each scenario. So sometimes we do have some professional speakers coming along if they can give like more information. For example, we've had like Narcotics Anonymous come along at some points, we've had pharmacists come along, we've had consultants at some of our events as well. And for the past 2 years, some of our events have been the journey of a stroke patient, management of COPD, could it be sepsis, and journey of a surgical patient. This year we have had a multidisciplinary team approach to paediatrics and a palliative care event, which was joint with IHI Society, who we have tonight as well. So our events are usually attended by 100 to 150 students at each event. It just depends on the capacity. So for example, when pre-COVID we had kind of in-person events, we would sometimes, for example, the cannulation one would be quite popular, but they would need like 2 rooms because, you know, there's lots of fake arms and blood flying around. So there's all that safety stuff that we need to kind of come in. And so in each event, we tend to have about 4 to 5 kind of stations, and people tend to like rotate around them. But because we're in COVID, we can't really do that. So our past events have just kind of been on Zoom, and we've had each speaker kind of go around and speak. So this year, because of COVID, I guess, we were lucky enough to host the first ever inter-university IPE campaign. And so this was #IPE Connect 2020. This was with the UEA, University of East Anglia's IPE Society, and we basically did like a joint campaign focused on communication, so that was our theme. And each week we had like a different theme, so this ran over the whole month of September. And week 1 we had like introduction, so we had kind of like health students, we had professionals, we had everyone kind of give us maybe like instructions in different languages. So they would often say like, hello, my name is, and based off of the hello, my name is campaign. And week 2, we had alternative communication. No, we didn't. We had jargon. That's what we had. And jargon, basically we went over how important it is within your own profession, and like the importance of like a good handover. So we all know that in our profession we have like, I don't know, OTC or PGD or UTI or, you know, all of these different things, and we might all understand it, but quite often other professions might not, or patients might not. So we kind of tried to highlight this. And in week 3 we had alternative communications, so that was kind of more Braille, British Sign Language, lip reading, emotional intelligence. We even had like an entry. So throughout this whole campaign, people were like put in different entries, and then we even had an entry that was some ballet dancers from UAE. They created like a dance scene with basically 2 sides, and they were like dancing, but they were having a conversation. So like their kind of dance moves mimicked like a conversation, which was quite cool. So that was like something like that. And week 4 we had like a summary week, so we just kind of went over everything that we had gone through the first couple of 3 weeks. We had like a charity quiz night, and yeah, we had just summaries from our lectures and stuff, so that was quite good. In just the first week, we already had over 250,000 people engage in our social media campaign, so that was quite a lot. So yeah, so that was a great success, and hopefully we'll continue to do that each year, with maybe different IP societies, or with CAPE UK, the Centre Advancement of Interprofessional Education. They're like the big adults that do in professional education. So why should you do IP work? I think a lot of IP societies across the UK. There's only, or to my knowledge, there's only the Aberdeen University one, which is up in Aberdeen, so we're the only one in Scotland at the moment. There's University of East Anglia, there's Cardiff, and there's Birmingham, who are called CASE. So there's only 4 that I know of at the moment. But for us, we our society has won awards every year. This year we won the Student Engagement Award. We managed to encourage kind of interprofessional education across Aberdeen. So all the students across Aberdeen University and Robert Gordon University benefit from it. We're the biggest society at RGU, and we have had the opportunity to collaborate with societies in RGU, so like IHI Society, the Farm Society, Physio Society, and quite a few other ones as well. And kind of across the UK, we've worked with UAE, the CASE in Birmingham, Cardiff, and we've worked with CAPE UK, and hopefully kind of more societies as we go through. So talking from my perspective, IP's kind of opened lots of doors for me, and it's kind of given me loads of opportunities that I wouldn't have had if I wasn't part of IP. So I've been part of IP since I was in first year. And I just kind of did some committee work in first year. Like the president kind of forced me to do some teaching at one of the events, and then I went on to be the secretary, and then now the president. So I managed to be the youngest women to watch finalist this year for the Pharmaceutical Journal. And I have been the finalist in the Scottish Pharmacy Awards 2019, 2020. I've won like half Scarlet Awards with distinctions at the university this year. I've been invited onto like the IPL Associates group at Aberdeen. So this is with like all of the lecturers, the kind of consultants, the heads of departments at the hospital in Aberdeen. And basically I sit on like as a student representative, and I sit there and kind of give them advice. Not that they need any advice, but I am the student kind of representative for that. And I've also been like a facilitator in IPL sessions, so I've been able to go teach like first and second year different IPL sessions that I once had like literally just 2 years ago. So that's all been a bit crazy. And I guess through IP I've managed to write articles for the university, for different organisations. I've made connections across the UK with professionals, with students, and I've improved both my skill set and kind of leadership abilities. So honestly, IP has made a massive difference to my university career, and it will probably make a massive difference to the career that I like hopefully progress onto. So why should we all have kind of IP experience in general? So I don't know about everyone else, but I found it often like quite frustrating, the lack of awareness that people have around pharmacy. So like the public, maybe other professions often maybe don't know as much about kind of our profession and what we can offer. And we can offer plenty of things, and no one often knows about that. And I found it quite demoralizing sometimes. So through the IP Society, we've managed to engage like loads of different professions like OT, physio, biomeds, off the top of my head, like physician associates, medical students and stuff. And all of these people learn through our kind of workshops and like our scenarios on what each profession has to offer to that specific scenario. So yeah, and I guess finding out about other professions. So at the start, before I kind of started pharmacy and before I started IPE, I couldn't have told you what an occupational therapist does. I couldn't have told you what a physician associate does. Sometimes I know obviously like basic kind of general stereotypes, like maybe like dietitian might look at food and stuff, but we don't know how much they actually do and they can offer to each kind of scenario and each patient. I also think that IP is one of the biggest kind of healthcare interventions in the world. I think that if we have really strong kind of multidisciplinary team and interprofessional education, then we would have like kind of excellent or better kind of patient care. So why is it important as a healthcare professional? I think that interprofessional education is kind of a key outcome that's emphasised by all regulators of healthcare professions, like for pharmacy, for medicine, for everything. Like it's something that is kind of brought to the forefront of everyone. And having good kind of multidisciplinary teams like lets you have more trust and more communication. You can develop like both personal and professional relationships if you know what each person does and you know how they can benefit you, how they can benefit the patient, how we can help each other, then you obviously build better relationships. So I think sometimes with so many different kind of professions and different people that are, say, in a hospital setting, you've got so many people that are there like to offer help. I think you can sometimes fail to see the talents and like the skills that each person can bring. And they obviously can bring all of their skill sets to the patient's bedside, and sometimes we don't utilize that as much. So we can definitely change that as we progress onto our profession. So I think it's important in patient-centered care because this integrated system kind of encourages excellence in patient-centered care and kind of increases overall patient satisfaction. If they see, you know, everyone working together, they're not asked the same questions by multiple different people. Like sometimes if there's not like any communication, they could be asked, or like, I don't know, so like say like, have you got any previous kind of, have you taken this medication? And then say the pharmacist asks that, say the junior doctor asks that, say they get asked that on admission. Like I feel like if you don't have kind of good collaboration and you don't kind of document that and pass the information on, then the patient might get fed up and be like, well, I've just asked that about 20 times. Like I've been asked that 20 times. Like I don't need to be asked that if, you know, one person already knows. I think that as students, we have the opportunity to kind of connect with each other like earlier on and like have early exposure to other professions. And hopefully as we progress on, we can change the kind of future. So yeah. So this is our social media. Feel free to kind of have a look. We have like what do you call them? Event summaries that people that have attended the events have like written in the past. So you can go through it and you can read what they've actually done or what we've done at each station, what they thought about it. And yeah, you can click through them. If you want to get involved, obviously we're lucky that COVID has made, or are we lucky? I don't know. We're sort of lucky that COVID has made everything online. So if you are wanting to attend any future events in like this semester, just give me a message on any of the platforms or give me an email or message. I think my contacts are in the last slide. And I can like get you to become a member. Our membership's only £4 for the next semester. So that will give you access to all the events and you can be a member if you're not Aberdeen. But yeah, Thank you. I'll take any questions. And if you would like to collaborate, if you would like to present, if you have any questions, if you want to meet someone new, if you want to be my friend, like anything at all, just give me an email or a message on Twitter and like I'll get back to you. So yeah, thank you.
That was brilliant. I think we all want to be your friend. So if anybody has any questions, feel free to just submit them in the chat or submit them in the Q&A, just if you have any questions for Vivian, or there will be time at the end to ask both Martha and Vivian questions if you don't have any right now. I'll just give it a minute in case anybody wants to submit any. So I've got a question. What do you think are the biggest challenges in getting involved in an IPE society?
Biggest challenges in getting other people involved or like involving yourself? Because I don't think there's many challenges in kind of like involving yourself.
And kind of, I think it's kind of like getting involved, like basically you choosing to kind of get involved.
I guess it's a little bit more difficult at the moment because obviously there's only kind of 4 IP societies across the whole UK that I know of, like 1 in Scotland, 1 in Cardiff, and 2, and they're all, so apart from Aberdeen IP Society, they're all kind of newly founded or newly taken over. So most of them still don't have kind of not enough experience, but most of them still haven't like kind of found their feet in like the IP Society kind of environment. I think if you're wanting to set up an IP society, go for it. Like I have helped set up a couple like across the UK. So if you want to, just give me a message and I can always kind of help with that. I think if you don't have like an IP society, you could always try and reach out to different societies. So for example, like as the Farm Society, I can reach out to like the Physio Society and like we can like try and get collaboration like there. So it's just, it's only kind of like interprofessional education between like 2 different societies, but you could still kind of try and integrate with them. I guess if you start to go into the working world, if you were in like community pharmacy or if you were in hospital, just kind of introducing yourself to everyone. So making sure that every time you walk into an environment or you phone like the GP surgery or you phone anyone, you say like, oh, hi, my name is this, I'm phoning from here. I'm like, your local pharmacist, and trying to kind of build relationships between that. But yeah, I think that's how you kind of get involved.
No, that's absolutely brilliant. We don't have any other questions, so if any pop up, I will come back to you at the end, if that's all right with you. And now I'm going to introduce Martha, who is the president of IHI, and Fraser, who is the treasurer of IHI.
Thank you, Joanna.
No worries.
Put this presentation up here. Hopefully everyone can see that okay.
Yep, we can see that perfect.
So, as Joanna said, my name is Martha Gilmore. I am a 4th year MPharm student at Robert Gordon University, and I'm the current president of IHI, and I've got here Fraser as well, who is our current treasurer, and he'll be speaking to you in just a little bit. So you're probably wondering just now, what is IHI? IHI stands for Institute for Healthcare Improvement, which is a global organisation whose mission is to improve health and healthcare across the world, across different settings as well. And they believe by working together as a team, we can create a future in which everyone has the best possible care and health globally. One of their key focuses is patient safety, and this is a theme we follow in some of our events. We tend to run 2 different kind of themes of events. We run educational events and we run social events. Previous educational events have touched on topics such as homelessness, pediatric learning disabilities, sexual health, allergies and anaphylaxis, palliative care, as Vivian mentioned, we did earlier this year in collaboration with the IP Society, and we've previously done a naloxone training with overdose awareness, which was one of our biggest events last year. Social events are a great way for our members to kind of meet people from within their own course, but also out with. Socially, we've run pub quizzes, bingo, scavenger hunts, had Christmas dinner, as well as doing some fundraising initiatives with bake sales, raffles, and a fun thing we used to do pre-COVID was sponge a lecturer at the end of the year after exams. This year has obviously brought new challenges for the society, but also, as Vivian already touched on, some new opportunities. Certainly for those of you here today that aren't based in Aberdeen, you have the chance to access our events online, and we've also had the chance to access online courses and online speakers that we weren't previously be able to have join us at our events. The benefits for being involved in the IHI Society for our members personally is that we can broaden their knowledge and understanding within healthcare. We offer events to a multidisciplinary audience, so we have a range of speakers on a topic, not necessarily targeting a particular area, but all talking around the same interest. For example, the allergies and anaphylaxis, we had a dietetic student and then pharmacy students talking about anaphylactic shock and things like that. Our events help foster the attitude of lifelong learning, which is something as pharmacy professionals we will all be well practiced at, and especially with CPDs and things like that to write. It's a continuous experience for all of us, and it's something beyond the course content that can help you further your learning and understanding of healthcare provision as well. Students have the opportunity to teach at our events, which not only benefits them within communication skills, but also can benefit other students, regardless of their discipline, through the knowledge and experience they get hearing that person speak about their profession and how they would treat a patient. Personally, I found being involved in the IHI Society, I've built up my confidence and my communication skills, but also many other kind of areas of working, such as team working, time management, event planning, handling financials, which all are useful skills to kind of have and develop. Attending other events as a student has taught me a lot about the multidisciplinary team, similar vein to what Vivian said. You're not fully aware necessarily of what other roles do on a daily basis, and having the opportunity to listen to them speak can really help further your own understanding and what we can do as an individual as well as a larger team for patient care as well. I think generally being involved in any group, regardless of whether it's a sports club or a society or an academic group, it builds your knowledge and skills, including prioritization, team working, and time management, which will all be critical in your future career. I'm going to pass over to Fraser, who's going to talk a little bit about his experience being involved in the society.
Hi everyone, so I am the current treasurer for IHI this year, and I came on board after only 1 year, so I'm in my second year now. But even after a year, I didn't know a lot about other things. Attending events definitely with IHI helped me learn about other fields, but from just being on the course, you don't know much about other people. And when we do the interprofessional learning, it isn't quite the same, and I do think these events, working with other people, is so valuable. But I remember I'd never heard of IHI until a few weeks into my first year, and I thought the president that was telling me about it was saying high and dry, and we were at a social event, and I thought, is she calling me an alcoholic? So it was a few weeks later then I realised she meant IHI, and I was like, oh, right, okay, I won't take a personal offence. I just wanted to get me involved in a society. But after that, I went to my first event with my friend, who is the Northern Area Coordinator there, and I'm actually in the back corner in that photo. There's a nice flattering view of my arm, and it was quite an exciting event because I didn't know what to expect. I didn't know what naloxone was. I didn't know much about overdose, and now I feel confident after that I actually know something about that, which is something that I'd never heard of. And I think that's a value. Oh, that's good to see us. I think it's valuable for people who maybe hadn't ever heard of these things. And it's always topics I find really interesting we do. Obviously, that's why they choose them. But as treasurer this year, my role is to do with expenditure and accounts. But luckily, Martha's given me a chance to do a little bit more interesting things and helping arranging events. So the first event that I started to arrange was sexual health, which was our first event this year, and it was really exciting. So I took upon myself to look into STDs and STIs. So this is my colour wheel that I did on discharge. Now, I don't know if everyone knows a lot about it, but I think discharge is a topic that not only we're not all really comfortable talking about, but also the information's so spread out. So I thought, if I bring it together on a topic that's a little bit complex and confusing, then this could really help patients, because bringing it together, what that colour of discharge means really quickly and easily can help, whether you're a pharmacist or any other kind of medical professional, you can read that really quickly and tell what could be wrong with the patient. And I think it really went down well at the event, all things considered. And it's an easy way of like looking at it. Definitely, I think it helped people, and it helped me understand it, because see, when I was making it, I kept having to move things, and it ended up quite a good layout, which has helped me in the future and will hopefully go on to help other people. Doing these events has not only given me communication skills, like I couldn't even imagine speaking to you on this without having done it before, and I think that's an opportunity that not only do societies in general give you, but IPE especially, and the IHI society gives you that opportunity to speak in front of people about topics that maybe you at first weren't an expert on, but now you've developed. Because I didn't know anything about discharge before I started looking at it. I didn't know anything about sexual health before I started researching it. And it gave you that confidence. And now if I come across that professionally or in the course or whatever, I'll actually know a bit more about it. And it means you're not daunted by anything anymore. And I think that's something that I can definitely say. Organising first aid training for our members online was definitely something that I'd never thought about until we realised we can't have people in person anymore. But we couldn't leave our members without something, because we were charging them. They've got to get value for money here. Although we are a charity, it would be cruel to give them nothing. So having an online training course means that not only can people do it whenever they want, but they can do it anywhere across the country. And having it in first aid, well, that could be saving lives. So although we are about patient safety, we are about making our members better pharmacists, better nurses in the future. And that's always exciting for me, to participate in that. I mean, the idea that we've saved a life, I think, is good enough for me. I've been in IHI for a year and a bit now, but I do feel part of something more, and I think that's important for people as well, especially this year with the coronavirus. Everybody's apart, no one can be together, especially with this lockdown that's just been imposed. I don't know about you, but I found that a bit of a surprise. And it just means that we're not going to be back on campus anytime soon, so we've got to continue online events just like this Webinar Wednesday. And I hope that it's been a success. I've definitely enjoyed it so far. Helping organising events has made me realise that this is something that I love doing, and I want to continue doing it, and I hope our next event interests people. Martha, oh, I've totally forgotten, what was I trying to say there? Our next event is on
Vaccines?
It's vaccines, sorry. I mean, with the coronavirus, and I still couldn't remember that. So it's on vaccines. I'm doing a CPD on it myself. I should have remembered it. The vaccines event is not only interesting because of COVID, but with all this anti-vaccine, and then it's about how all the different multidisciplinary people are getting involved in this, which I think will be an exciting event for everyone to attend. And since it's online, you know, it'll be a bit easier for everyone to come. I've not got more to say about my journey through IHI.
That's fine. Thank you, Fraser. I hope everyone's found that useful. Certainly, I know sometimes it can be a bit daunting when you have people sitting here that have been through most of their degree journey already and have been in positions for quite a long time. Sorry, there we go. This is our social media. Feel free to have a look. We're mainly active on Instagram. We've tried this year to kind of make that a bit more of a connection between people and start campaigns on there. So we did a mental health campaign throughout October and kind of asking different questions and getting different people's opinions on things like self-care. Feel free to email us or send us a direct message if you have any questions after the event. And the website there is our union page which can tell you a little bit more about the society as well. And thank you so much for listening to our presentation, and Fraser and I are happy to take any and all questions.
Perfect. Thank you very much, guys. It's great to hear first on personal experience. I go to RGU as well. I'm a second year with Fraser, and that photo where you saw Fraser, I am sitting next to him in the blue scarf. I think that's kind of what he said. So if anyone has any questions, please feel free to kind of pop them in the chat or pop them in the Q&A. It's great to hear some personal hands-on experience about a personal kind of journey. It's great because encourages people to get involved and to see what could become of something. So it's amazing. Is there any kind of way that people that aren't in RGU can attend events or anything like that? Because I know a lot of societies don't have kind of IHI, and it's a great opportunity to get kind of involved in.
Absolutely. So as Vivian mentioned, we're offering online membership. Our membership is £5 for the year. It's available on the website there, and it's an opportunity that then you get added to a Microsoft Teams, which has got all our members in together, and that's where we announce all our events and put up links for the people that are in our membership base. And like I say, you can get involved there. If you just want to ask us any kind of questions as well, we're always open for that as well, if you're not kind of wanting to sign up for the actual event on the day. But yeah.
Perfect. That's absolutely amazing. We've not had any questions in, but I'm not going to hold my breath. People like to submit questions, so no, that's absolutely amazing. Considering a lot of societies don't have any form of IPE or IHI or anything, it's great to get involved anywhere you kind of can, especially being online. Better take that advantage while we can, because it's not going to last forever. Hopefully, all going well, touch wood. But yes, IPE is so important, and so many people use it day to day in their careers. So learning how to kind of work with these different groups of people is essential. Knowing, just understand what their role involves and what they do is essential, because you want other people to know how you work and what you do. And so it's just a team. You want to work as an essential kind of team. So thank you, guys. We've not had any questions through, but thank you both, all of you, kind of for attending tonight. So just before we kind of finish up, we just kind of have some BPSA business. I will post our social medias in the chat. So this is where you'll hear about any future events, Webinar Wednesday,